Now I'm here at the College of Medicine Building, Singapore General Hospital, and this just in. The Health Ministry has confirmed one more coronavirus case, bringing the total number of infected to 85. Now the latest patient is a 36-year-old male Chinese national who is a Singapore work pass holder. He doesn't have any recent travel history to China. Although the number of new cases has fallen, Director of Medical Services Associate Professor Kenneth Mark reiterated the need to practice good personal hygiene.
We're coming close to a month after the confirmation of the first case of COVID-19 in Singapore. We will continue to monitor the situation closely and fine-tune and adjust our measures accordingly as the situation evolves. While we expect to see more cases in Singapore, partly as a result of our enhanced surveillance put in place, it is important that life must go on, albeit with extra precautions. And everyone in Singapore can each play our part. Observe good personal hygiene, such as washing our hands with soap and water regularly, and avoid touching our face and eyes. See a doctor when you're unwell, and that's the key way we can all protect ourselves and reduce the risk of transmission.
Okay. Now, the Health Ministry also announced that 3 more coronavirus patients have been discharged from hospital. In all, 37 patients have fully recovered, but 48 remain in hospital. Now, 4 are in critical condition. I am now joined by journalist Timothy Goh, who has been following the developments very closely. Welcome, Tim. Now, Tim, during the briefing earlier, more details were shared with regard to the previous confirmed cases, specifically case 82. Now, case 82 was one of the confirmed cases identified yesterday and was first diagnosed to have dengue. Could you elaborate more on case 82?
Sure. So case 82 is a rather interesting case. As we all know, she was admitted to Ng Teng Fong General Hospital as a dengue patient on February 15th, and on February 18th, she was subsequently diagnosed with COVID-19. Now, what happened in between those days is that, from what we understand, she developed respiratory symptoms that therefore led to her being tested for the COVID virus. However, it was not a misdiagnosis of dengue. We want to clear that up. So she was diagnosed with dengue accurately, and she also had the COVID virus at the same time.
So does this mean that the dengue has led to COVID-19?
I want to say no, absolutely not. There's currently no evidence that dengue can lead to COVID-19. In fact, this is the first case of its kind in Singapore. And while we're not sure about the entire global situation, there's currently no medical link between the two conditions.
And what happens to the other close contacts of hers?
So the woman was warded at Ng Teng Fong as a dengue patient, which means that all the other patients in the same ward as her will be under quarantine in Ng Teng Fong General Hospital. At the same time, healthcare workers who have come into contact with her, there'll be a need to assess whether they were in fact close contacts of hers, and if they were, they will be quarantined.
Well, thank you so much, Tim. That was journalist Timothy Goh, who has been following the coronavirus development very, very closely since the start of the outbreak. Now, in the meantime, the Immigration and Checkpoints Authority has issued 77 stay-home notices as of noon today, 12 hours after the scheme has taken effect. Now, those notices were issued to Singapore residents, long-term pass holders, and foreign workers who have travelled to mainland China in the past 14 days. Travellers from Hubei province are excluded from this scheme as they are quarantined. Now, if you recall, this scheme replaces the leave of absence and has stricter repercussions. Those who do not adhere to the stay-home notice can be prosecuted. I'm Hairianto Diman reporting for the Straits Times.